Coronary angiography and possible angioplasty. Introduction. Sometimes people have serious problems with their heart and the arteries that go into it. An angiogram helps doctors look at the blood vessels of the heart, and if needed, an angioplasty allows them to open arteries that are too narrow for adequate blood flow. If your doctor recommends a coronary angiogram and possible angioplasty, the decision whether or not to have the procedures is also yours. This patient education module will help you understand better the benefits and risks of these procedures. Symptoms and their causes. Cholesterol deposits accumulate in the coronary arteries, forming a plaque that narrows the artery. Narrowed arteries do not let enough blood go through. This causes blood flow to decrease, which could lead to heart attacks. This is the cross-section of a normal blood vessel, and this is the cross-section of a blood vessel clogged with plaque. If blood flow is reduced enough by cholesterol deposits, the heart will not be able to keep up with exertion. If the condition worsens or the coronary arteries become blocked, the heart can be damaged. An angiogram is a test that helps show the plaque in the coronary arteries and helps detect any narrowing or blockage. Other tests, such as EKGs or heart tracings and special CAT scans, can cause the doctor to suspect blockage in the coronary arteries. However, these tests do not show the blood vessels. A coronary angiogram is the only reliable test that shows the blood vessels of the heart. Procedure. Your healthcare provider may ask you not to eat or drink for several hours before the procedure. If your surgery is in the morning, this usually means no food or drink after midnight the night before. During an angiogram, the doctor inspects the coronary arteries for blockage. If the angiogram shows blockage, while tubes and other instruments are in place, the doctor can correct it with an angioplasty or an alternative procedure. If the angiogram does not show a blockage in the arteries, you will probably be able to go home after the test is completed. This procedure is done while you are awake. There is virtually no pain involved. You will be asked to lie down on an X-ray table. During the procedure, the heart rate, blood pressure, and vital signs are continuously monitored. The groin area is disinfected and made numb with a local anesthetic. A catheter is then inserted into the artery through the skin in the leg and threaded all the way up into the coronary arteries. Sometimes, depending on the doctor's preference and the state of your arteries, the catheter may be inserted in a big artery in the underarm or the upper arm instead of the groin. Dye is then injected in the arteries and X-rays are taken. You should stay very still during the X-rays to allow good, sharp images to be taken. If a blockage is found, the doctor will decide whether it can be opened using either a balloon or another device. The procedure that uses a balloon is called angioplasty. The balloon is attached at the end of the catheter and is threaded up to the area of the blockage through the artery used for the angiogram. The balloon is then inflated to break up the plaque, which widens the artery, allowing more blood to flow through. The balloon is then deflated and withdrawn. Following the angioplasty, your doctor may choose to place a stent, a stainless steel mesh tube, at the site of the blockage to keep it open. If a stent is used, it is attached at the end of the catheter and placed at the site. A stent may also be used without a balloon to open a blocked artery. Another way to open blocked arteries without angioplasty is a small mechanical device, instead of a balloon, that breaks the plaque into pieces. This decision is made by the doctor at that time. In addition to breaking up the plaque, a stent could be placed. After the angiogram with or without angioplasty, the catheter is taken out. In order to prevent bleeding from the puncture site, You will be instructed to lie flat and not bend your leg. If your cardiologist uses a closure device, you will lie flat for about 1 hour. If not, you will lie flat for up to 8 hours. You should not bend the leg on the side of the groin that was catheterized. You will probably not be able to drive and will therefore need somebody to drive you back home.